Thank you for taking part in this edition of SCPHRP Meets. Would you briefly introduce yourself and tell us what you do?
Yeah, my name is Mike Kelly, Professor Mike Kelly. I'm an honorary senior visiting fellow in the Institute of Public Health and Department of Public Health and Primary Care at the University of Cambridge, where I've been since 2014, the end of 2014 when I retired from the National Health Service.
How did you first get into public health?
In a rather circuitous way, really. I read economics and sociology as an undergraduate, did a master's degree in sociology and specialised in industrial sociology and social stratification theory. And social stratification took me in my first teaching job, which was in Dundee, into the study of health inequalities. And that, I suppose, was really the starting point for my interest in public health generally, but it was from a very social scientific point of view to begin with. I did a PhD in psychiatry, which took me into health education, patient education and health education. And a combination of the health education, patient education, drifted me eventually towards public health more specifically. And eventually I was appointed to a post as senior lecturer in the Department of Community Medicine to become the Department of Public Health at Glasgow University. And in one way or another I've been in public health ever since.
So onto your research within public health, what is the most interesting piece of research that you've been involved in?
Well, the last job I did before I retired was as the Director of Public Health at NICE. So I stopped being an academic around about 2000 and went to work in the National Health Service. And one of the things that NICE had to deal with was develop public health guidelines on disease prevention, health promotion, that kind of thing. But central to all of that was an interest and concern about health inequalities, which had been a long-running thing, as I said, from the very earliest days teaching in Dundee. But it was quite clear to me that while we knew a huge amount about the associations between socioeconomic position and ill health, we didn't know enough to be able to specify what kinds of interventions were needed, particularly for particular and different groups in the population, to apply our guidelines in a forensic way, if you like. So when I finished at NICE, I was able in Cambridge to turn that question into a research programme, and that's the work that I'm currently and still doing in Cambridge with colleagues. And in particular we're interested in being able to understand the nature of the population in enough detail to understand the way its dynamics affect health, but also to try and understand the interaction between biology and society more specifically and generally. So I suppose that's the most interesting piece of research, but it's the current research I'm doing. Over the years I've been involved in many different pieces of work. Back in the day I did one of the first randomised controlled trials of health checks in primary care, and that was very interesting. That was in Glasgow. Some years ago, in the last several years I was at NICE, I was involved in a programme of research on nudge theory, which was both very contemporary and quite exciting to do. And presently I'm involved in the study here in Edinburgh and Belfast on the impact of changing speed restrictions, bringing down speed restrictions in those two cities, what happens, how, and so on. So in one sense it's what I'm working on at any given moment. That's the most interesting thing I'm doing. But I've had a fairly eclectic research career, and I've enjoyed it all.
What do you think the biggest challenge is that's facing public health today?
Well, there are many. Specifically in terms of the patterning of disease, theoretically preventable diseases associated with alcohol misuse, obesity, and lack of physical activity are showing few signs of declining and of becoming of epidemic proportions. And the obesity stuff in particular, with its links to type 2 diabetes and a range of other theoretically preventable conditions, make it an important priority. However, behind that, while we know, and I used the word theoretically preventable a couple of times there, the reason for that is, at one level it's dead simple. get people to change their behaviour, and job done. But we've had nearly 6 decades of public health attempts to change people's behaviour, which have been at best suboptimal and at worst a huge waste of money and time. And so, although we know what the problems are, the tools with which to deal with them are fairly underdeveloped, very underdeveloped. And sadly, the policymakers and all political parties, I would say, are locked into oversimplistic understandings of the problems. It's all about behaviour change, or it's all about the wider determinants, or some mixture of the two, without any detailed account of what, knowing that, you need to do to bring about the kinds of change that are necessary. And unless and until we're able to bring about a change in the way that the politicians and policymakers think about the problem, we'll go on in much the same way and with almost no chance of long-run success.
What piece of advice would you give to young researchers, or new researchers?
Young or new, or both?
Or both.
Well, actually, what I would say to them is, as you begin to think about the kind of research you want to do, think about the policymakers you wish to influence by that kind of research. Doing research in an academic vacuum is not very helpful to the kinds of problems we face in public health. And it's important at the very outset to think about the kinds of ways that the findings which may or may not emerge are going to be helpful in bringing about the sorts of changes I'm talking about. So it's not just about getting published, it's not just about getting your paper in the top high-impact journal. It's about persuading those who have the power to bring about change that they can do so, giving them something useful that they can use. And by the way, that doesn't mean telling them they're wrong. They often are, but telling people they're wrong is not the way you change their behaviour, and that includes politicians and policymakers. So my advice is very clear: make sure that your work is grounded in the real world of policy and politics and practice, and seek to bring about changes there in the work that you do.
One final question, Professor Kelly. What do you do to relax?
I row. I'm still a veteran rower, veteran oarsman. I get out on the canal here in Edinburgh periodically, and until I moved to Edinburgh, I was rowing down on the Thames every weekend. So that's the physical activity I do, and the things that go with that. But I like to spend time with my family. I enjoy good food and relaxing in that kind of way.
Excellent. Thank you very much.